Welcome back to Great Day. If you're experiencing swollen legs or feet, especially after standing or sitting for long periods, or maybe you're feeling numbness or tingling, it could be signs of poor blood circulation. At Modern Heart and Vascular, they specialize in diagnosing and treating vascular issues. Here to help you take the first step toward relief is Dr. Rajiv Agarwal with Modern Heart and Vascular Institute. Hello there.
Good morning, Deborah.
All right. This is one of those areas that the reason why you want to do these segments is to educate people. You can save time, save money, because a lot of times these issues are misdiagnosed or undertreated or mistreated. I have a friend who's got a leg I looked at and went, oh wow, she thought it's a dermatology issue, right? With the veins that were sticking out or the scaly purple spots. So no, it's not dermatology. Or they'll go to the doctor and say, I have restless leg, and leave it with a prescription. That's not taking care of the problem.
Right, you've got to find the root cause of the problem. A lot of people are misdiagnosed and told it's arthritis or restless legs or neuropathy, but it's really a vascular issue.
Yeah, all right. So vein disease and poor circulation. And veins, like, there's a lot of them running through our bodies. And kind of like a garden hose, if one has a kink, your body's going to know it.
Right, there are thousands and thousands of miles of veins and arteries in our body. So, and there are a lot of symptoms that happen with that.
All right, I'm going to try to remember my biology class. With veins, okay, we have arteries and veins, and they kind of do two different things, even though they're part of the same system.
Right, arteries take the blood from the heart and go to the toes, and veins bring the blood back from the toes after it's been used by the muscles.
Symptoms tell you what could be happening. So with arteries, what are some of the symptoms of poor circulation?
So arterial symptoms you get with walking. So if you have exertional pain in your legs, tiredness, achiness, burning when you're walking, with activity, it's arterial.
Yeah, kind of like when they say that Herman Munster issue where your legs feel super heavy. Is that one of the things too?
Yeah. Some people come and say, hey, I felt like I'm walking from my car to inside the home, my legs hurt.
Yeah.
That's more of an arterial issue.
Okay, and then when you have symptoms of veins with poor circulation?
Vein issues are more at rest. So when people have symptoms at night, when they're sitting or standing, such as cramps, Charlie horses, restless legs, swelling. A lot of people have many of these symptoms, Deborah, and they just don't do anything about it.
Yeah. Well, you know what we do is we compensate, so we don't walk around as much, right? And we kind of close in on our life. And as they say, sometimes that's when things take a left turn, is when you just kind of take your life and stay away from people, don't get out, don't move. And moving is one of the things that keeps us young. Okay.
Absolutely.
When it comes to risk factors, there are several. One of them is just the fact that you have legs and you're aging, right?
Right. For arterial disease, it's more like blood pressure is high, cholesterol, diabetes, smoking, COVID. But for vein disease, it's more gravity related. So people that are sitting or standing for long periods of times, like hairdressers, teachers, nurses, doctors, people that are just not moving around, gravity is pushing the blood down where the blood is trying to come back up.
Yeah, for some people, going to the doctor, no problem. For my mom, it was on her social calendar, right? But for other people, they have a fear of going to the doctor. But when they do the diagnosis for this, trust me, it is so easy, it is so quick, and it's non-invasive.
It is, absolutely. Step one is we got to talk to the patients. They come into our office, we sit down and listen to them and see what symptoms they have, and do they jive more with arterial disease or vein disease. And if needed, then we do a very simple ultrasound, which is painless, and that clinches the diagnosis.
Yeah, and I've had that ultrasound done because I had a swollen ankle and we were trying to figure out why it was swollen. And it was like, okay, that's it, you're done. And it turned out it was not vein disease. There are also various treatments. The other thing I think that stops people from coming in is they saw mama or grandmama or grandpa or grandpa go through a thing called vein stripping.
Right.
You don't have to do that.
No. Vein strippings are a thing of the past. They were bloody, they were painful. Now we have 5 to 10 minute, non-invasive, minimal. You drive yourself from work, we do it. You drive yourself back home or back to work.
Yeah. Or you tell work, I'm sorry, I have to go to the doctor today, and then go to the mall, have a good time. Right, okay, different ways of doing it. Blockage treatment, there's what we jokingly call the Roto-Rooter procedure.
Right, so Roto-Rooter, basically you're just cleaning out a blockage. There's cholesterol buildup, there's blood clot. You basically are drilling through there and opening up that blood vessel, and you walk out and my walking symptoms are gone.
Yeah, when you say drilling through there, I know it sounds, you're like, wait, what? No, it's seriously, you don't even feel anything. Okay,
right.
The VenaSeal treatment.
Yeah, the VenaSeal treatment is for vein disease. So VenaSeal is a glue type of product. So the whole point with vein disease is you're trying to move the blood from the bad veins to a good vein. So if you can seal off the bad vein with glue, and move all the blood to a good vein, those symptoms are gone.
Yeah, yeah. All right. Early vein disease, there are some other things that you can do that are fairly simple that someone can do themselves. Compression socks, leg elevation, losing weight is a big factor.
It's a huge factor because the higher center of gravity you have, the more effect of gravity on your legs.
Yeah, all right, restless leg syndrome. We've seen a lot of commercials about it and like, use this medication. Again, back to your point, do we use the medication or do we get to the root of the problem?
No, you got to get to the root of the problem. I'll give you an example of my mom. She was diagnosed with restless legs. She was given 2 different medications. And finally, her son, who's a cardiologist, she decided to tell him about it. And then we did the same ultrasound. We found she had vein disease. We fixed her veins. She hasn't had one leg issue for 9 years now.
All right, you are a good son. Thank you so much. To book an appointment with a board-certified cardiologist at Modern Heart and Vascular Institute, visit them online at modernheartandvascular.com. That's modernheartandvascular.com. You can also call them at this number, 832-644-8930. Again, that's 832-644-8930. They accept most major insurance, including Medicare. Appointments fill up fast, so contact them today. Modern Heart has locations throughout the greater Houston area, including their newest locations in Tomball and in the Medical Center.